Hello, everyone. My name is Gitika Gorthy, and today I'm very honored to be interviewing a very special space champion, Miss Kimia Seyedmadani. Miss Seyedmadani is a very energetic biomedical engineer that has interned at NASA through the Pathways program and recently became a full-time NASA civil servant working for the former program, the NASA Human Research Program. She is also working on her Ph.D. currently. She also aims to increase life expectancy through transdisciplinary research and understanding humans as a complex adaptive system resilience modeling. She mimics biological, physiological, and physical adaptation in space exploration via translation to countermeasure technologies to conduct her research in biomedical and bioastronautics. Her story and background is very inspirational and unique, and she is self described as a Renaissance woman. I'm so excited to be able to understand her journey on a deeper level. Welcome. Thank you so much for taking some time out of your busy schedule to conduct this interview.
I'm super excited to be here, and I'm very excited to be able to answer two questions.
Yeah, before we jump into understanding what really got you into space, how you love the space industry, first I'd like to know more about your typical day. By typical, I mean the virtual pandemic typical. What do you currently do and how does it run?
Interesting enough, I work for a group of people called Research Operation Integration Group at NASA, who are delivering hardware for human research program. Our job is to develop medical hardware and software, both sustaining them and developing them for the astronauts and crew health on ISS. So we consider a mission critical people, and therefore our building is actually completely functional during pandemic. We have all the CDC protocols in place. We have room numbers, the limitations for the people, distancing, social distancing, masks, gels, everything that you can think. And the entire time that the pandemic was going on, actually my colleagues worked in that building 24/7 to make sure the astronauts are safe and some of the science can continue and move forward. My day-to-day jobs goes from sustaining some of these equipment, such as ultrasounds that's on ISS, till building some of the newer technologies and helping some of the PIs in the lab and just putting fasteners in and testing and doing all the fun activities. And sometimes, occasionally, if there's a failure on orbit on any of the equipments, we get a chance to talk to the crew members, discuss what happens, and figure out, based on operations, flight surgeons, engineering, and the sciences, what can we do to figure out what went wrong and how can we fix it.
Wow, that sounds like a really fun job that I would definitely like to do. And you were mentioning how you guys develop hardware, and I'm sure a lot of people are curious. Do you guys have like a certain list of technology or certain problems you want to solve, or is it based on every individual who works at NASA to come up with their own research topic, something that they're passionate about?
So there are different paths for that. We do have a human research program that has been kindly putting a human research program roadmap together that is looking at all of the concerns that it came up throughout our flights, and also the likelihood that it might come up in during the flight operations into the gaps. And the researchers apply to that gaps, and engineers and technologists come up with the solutions for that gaps to be aligned with the researchers to answer those questions. Along in those, we do also have operational concerns like the flight surgeons, as you mentioned, or the medical capability groups who have specifically day-to-day medical and health operations. Simple things like stretching yourself or pulling your muscles. You do have exercise physiology group at NASA who do look at exercise. They will have their own trainers also. So some of the equipments that we need to interact with these all groups or monitor the crew members, like even the Fitbit that you might have on your hands or something like that. There's no Fitbit on the station, but there are some similar stuff like Active watches is on the station. Those types of equipments has to be developed for the flights, for the environment of the flight, and it has to be maintained for the crew members and interactions between them. So we focus on the hardware side, but the HRP develops the gaps and the models, and we try to match up with that. Meanwhile, if somebody comes in and have a very great idea that thinks that it's a need, we can bring it up to the power to be and discuss and solve the problems. In addition to us, parallel to us, there's a TRISH program, which Translational Research Institute, Health Institute, that is from outside of the Baylor Medical School. And they try to go outside and look at the I want to say out of the box thinking on the edge topics and technologies that they just came out that can help for the space application and also medical applications. And they bring in some of those into us. Along to that, there's cases also that are looking at biological research, not just medical applications, but also any biological research like food or other types of research that might impact on Earth. And they bring all of those back to us. We also help with other NASA contractors that are out there, like bioserves, nanotechnology, some nanoracks, sorry, not nanotechnology, nanoracks, this space company, and many others to help them with their research in the space station. So it's a very involved, wonderful thing to do.
Yeah, it's just not one group. There's so many different programs outside of NASA, within NASA. They're doing so much research, which is like so exciting for the future. And earlier, yeah, I was mentioning that you were earning your PhD. And so you've probably had some really cool research experiences or some fun projects that you were a part of. So could you share, if you had to pick one, the most exciting project or research that you have worked on or are currently working on?
Oh, the list is very long on that.
Yes, that's why I said if you had to pick one. Everyone I've interviewed so far had a very tough time picking one.
Jeez, that's a tough one. So I had a wonderful opportunity of working and going to school all the time, and that allowed me to have both understanding of operation, integration, and also the research. I did a master's in biomedical engineering in Arizona State University that developed a system to study nucleation and growth of ceramics to understand the effect of microgravity for the bone loss of the astronauts. That was a really neat question, and I had a lot of multidisciplinary. And because of that, I got interested in bioastronautics. I did research in bioastronautics at University of Colorado Boulder, and currently I'm working with University of Houston, Dr. Metin Akai's group, who is a lead in neural engineering, and he's the also the president of EMBS, IEEE EMBS, with Dr. help of Dr. Leland Stone from NASA Ames, looking at ocular issue of the crew members and some of the changes that happens to the eye of the astronauts, and looking at developing the system that can measure the ocular performance of astronauts, not just changes physically as structurally, but also effect on the operations, which is basically a topic of my PhD. And I'm hoping that be able to conduct it at JSC with the help of those folks and engineering director as well as NASA. So that would be probably every project that I did was exciting. So this is my newest project. So I would say that this is my favorite right now.
Yeah, definitely. That completely makes sense. And a lot of individuals, like when they hear terms like bioastronautics or, space medicine or healthcare in space, they get a little confused and like they don't understand the importance of it. So could you explain to us the importance of bioastronautics research to those on Earth and how it applies to the general public and not only astronauts?
So the term bioastronautic was defined as the study and the support of life for space applications. I look at it as a little bit different. I believe this is not just a study and support of life in exploration, but also the impact of that on Earth. And the way that I view it is developing the countermeasures for the crew members is great, but learning from that adaptations and the complexity of the adaptation and the resilience of the astronauts and be able to design better medical hardware for Earth is equally important. And I'm always looking at the relationship between them. So if you want to look at the historical data that is out there, Amgen and Eli Lilly and Merck are three pharmaceutical companies that are very famous for developing pharmaceuticals on a space and trying to apply it on Earth. For example, Amgen developed a medicine that is for osteoporosis, which is basically lack of the density of the bone and usually happens for elderly women in a space, and then went through the FDA and got approval in order to sell it on Earth. The reason they use a space is that their model in the space could have been 10 times faster than the study that they could have done on Earth. It's not only saved cost, but also save the time of production and time of bringing it back to the people on Earth to be able to use it. And they've been very successful in that market. Eli Lilly is actually developing muscle atrophy medications. And Merck has been doing since 1990s research on developing the new pharmaceutical crystalline tablets that can dissolve in the body in a different form, and it can structure in a different form that can help with many diseases, not just osteoporosis. So these are the ones that I can immediately say that comes to mind. Another ones that I can mention is that ultrasounds procedures that we have. Ultrasound is one of the imaging systems that we do in ISS. A lot of the ultrasounds imaging that we do has to cover a lot of organs in the body. Now, the people who are familiar with the CT scan imaging and X-ray imaging, they know that the radiation impacts on those and the negative impacts on those for especially people that are pregnant or have had cancer. Some of the ultrasound systems that we have, because of the modification that we did, the main companies that they designed them, they did those modifications and they brought those protocol to the hospitals. So now they can use those as a combined with what they have for the particular patients, which is helps the health of those patients as well. So there's a lot of examples of that that I can pull one by one. Since day one that we had a person in a space, we had to do health monitoring for them to make sure that they're safe. As a picture behind me is the moon landing in 1960s, 1970s, sorry. It is important to remember that the mission was to take the man to the moon safely and bring them back. And it's still up to this day, NASA's mission is wherever we go together and we come back together all. So
Yeah, that's really interesting. I was reading an article earlier that was also by NASA, and they were, saying how certain like disease cells behave differently in microgravity and allows us to like see more functions or features of certain cells. And I thought that was really cool because the microgravity environment in space provides us that different research experience, a different research facility. And I think that's really cool that we're able to identify more factors we didn't know here on Earth, which gives us more insight into developing different medications or treatments or et cetera. So that's really interesting for sure. And you were mentioning earlier how there's like flight surgeons in space. And it always got me thinking, does every mission have a flight surgeon that goes on board? Or do they have like a certain astronaut who's trained to take, be prepared in case of an emergency? Or are they increasing the use of like AI technology in space? Or, what is your thought on like automated or telemedicine or, compared to flight surgeons, for example?
the answer to all that question is yes. So what do I mean by that? We have a flight control room in JSC. In the flight control room, there's a flight surgeon, there's a psychologist, and there's a biomedical engineer that sits on one panel. They constantly have interactions with the crew members.
Okay.
Sometimes we get lucky and we get a surgeons or we get a physicians who is happen to be also an astronaut on the on the missions, which is really awesome when we get those. For example, the last mission was the last flight. I'm sorry, I don't recall who's the last person that's flown that was a physician, but Dr. Przensky would be an example of that. Scott Przensky. As far as AI goes, there is a software that has been designing by a medical capability of NASA, EXMC. It's called Impact. It is actually based on historical data that we have about the space applications. Also, all the data that they could gather about the age of the crew members and relative medical complications that may happen for that subjects or for that range of age, as well as all common hospital data that we could gather from hospitals. The impact software has been written by many people, including physicians, nurses, hospital, medical, biomedical engineers, and a lot of different group of folks that came together to write this software, along with the flight software people that they write the flight software so that integrate this into the library of the flight, so that if a complication comes up, they can tell to the system what was a complication, what's the impact, what is the treatment, what should they do. It doesn't diagnose basically, but it allows you to know what are the treatments are and what can you do, and if that resources needs to be in the craft. So one of the constraints of the space flight is your mass, volume, and power. So we love to have an entire OR on board of a station.
Yeah.
It does not happening. It just doesn't have enough power to support it. It has complication with the sterilization units. It's hard to have all of those tools and the trainings, and all of those is the constraint. So with knowing all of these statistics, which is comes in the field of statistics into this, right? And understanding the risk associated with it, we can make a scientific and informed decisions on what kind of equipment we can have on board to support our crew for the mission that they have. Also, depends on the mission that you're doing, the chance of injuries will change, right? If you do an EVA and you're outside of a space station, so you exert your body, you have to fight through the suits and doing all those work, and you have the fatigue in the muscle. Maybe it needs more of a muscle relaxants. If you're doing something else, you might need something else representative of that. So we take all those into the account, and that's why we always try to have a physician that is looking at. So a flight surgeon is one part, but bioinformatics is another part. You know, the software engineers is another part. The statistician is another part. All of these guys are RNs, like the what do you call the nurses is another part, right? All of these are in medical field are helping to ignite the rocket and help the rocket to get where it needs to go, and the missions, if it's not the rocket, it's just ISS, it's still orbiting around the Earth.
Yeah, the amount of like teamwork that integrates into this one mission, for example, is really cool to see the final outcome of. And yeah, you were saying about the mass, because of the budget NASA has, they can't spend, billions on just sending medical supplies. So they have like a limit on the mass of equipment they can send. And when you read that, I didn't actually like know too much about it earlier, but when I was reading it, I was like, oh my gosh, how do they pick and choose what to take? And that makes sense based off of the missions they're doing, what type of potential problems the human body may undergo. Sending equipment based off of that is, yeah, definitely that makes sense. And it's really cool. I feel like a lot of people didn't know about this before. Yeah. And
It is a very interesting procedures, and it is a very interesting interactions, a multidisciplinary area, and it relies on human communication. It relies on a lot of respect for different fields. It relies on understanding that everyone matters more than anything else. So if you think you have a passion for space, if you think you can do help, the door is open for everyone.
yeah, yeah. And part of the interview series is to show that there's not a certain one job. Like you don't have to. When people think of space, I feel like they think of engineers or maybe computer scientists or physicists. They don't think of the vast number of other careers you need, not only in the medical industry, to get more simple, something as like space art, like fashion design, when you're like, creating NASA logos, NASA things, or, astronaut suits, thinking about different materials, architecture, like just so much, I could go on for days listing the number of two things. Like space is so interdisciplinary. You can combine two, like space and any other topic, and literally there's probably a career out there. And if it's not, you can make one and it'll work, because space is like literally its own like world basically.
This is all melting pot, yes, or
Yeah.
sandbox of design.
Yeah. And earlier I was mentioning how you were part of NASA internship programs. And I know a lot of students, whether it be high school, college, they have always been trying, especially if you want to get into the space industry, I feel like a NASA internship is always something that a lot of people look for. And I was wondering, do you have any tips or advice for students when they're applying, how to go about it, and maybe share some, like one or two cool experiences you had in your internship?
So, um, as a space is my second career, and had a career in bioengineering. I never had an internship as an undergrad. I worked in research labs, but I've never had an internship. So this was my first internship after working in industry. So it was a little bit different for me. But I got a USRA position at first, and then I got a KBR Wiley position, and then I did a pathway programs. And each of them came with a different set of skills, a set of requirements, and different types of things that I did. As a USRA intern, I worked with the same group that I am working right now. Actually, that was my first exposure. I was designing a 2 level of containment science enclosure for the astronauts to do biological science in space. It was really fast learning, but also it was really cool because I actually got to build something that I knew that is going to implement in ISS. And also I knew that my responsibility was to make sure it's safe. And I went through the safety reviews, but I knew that if it would fail, it could actually be, it could end the entire ISS because it could contaminate the entire ISS, which it was fun to know that. But the fact that as such an early, if you want to say career, I was given that opportunity to be so hands-on was really interesting to me. Um, I would suggest to anyone that gets internship in NASA, don't be afraid. Ask questions as much as you can. And I asked plenty of questions, and I met a lot of people through that. Be ready to answer questions. Don't afraid of being wrong. It's okay to be wrong. I'm often wrong. It's okay. Even now, I'm wrong. I am okay to say I don't know. Let's figure this out together. Because that's very important, no matter what stage of the career you go. Now, for the folks that wants to be a civil servant versus they always get this question, what's the difference between a civil servant and a contractor at NASA? NASA Johnson Space Center has 15,000 worker on site. About 3 to 5,000 of them are civil servants, and the rest are contractors. One of the biggest biological and life science contractors that we have is KBR, and they used to call Wiley Laboratories. And there's not much of differences. I can't tell you a lot of differences between them. The only thing that it mattered to me versus each other was the fact that I could do more of a research side of the things rather than hardware development at the time. And that's why I chose to be a civil servant. But they work as equally as important to our missions than anyone else. Now that we are expanding, even now we have a commercial cruise that is coming out. So I heard many of my friends not working in NASA for space applications, but they go to SpaceX working for, space stuff. Or many small companies are coming out, which is also that are helping our missions for the future, which has wonderful, like, example of a vision for Mars is a ophthalmology group that is developing vision equipment for Mars mission, which is, I think, super exciting. So I encourage you, whatever you want to do, if you want to do an internship in the space, don't just focus on NASA. Just look everywhere that you can to get a hands-on experience. That would be my advice to anyone that is interested in the space application.
Yeah, I think that's a great point. I mean, previously, when you thought of space, it was mostly space organizations like government agencies. But now that we're starting to go more commercialization, we can see so many private companies like SpaceX, or, like more integration of companies, Blue Origin, Lockheed Martin. There's so many companies that are starting to not it's not just NASA or not just Israel, not just the European Space Agency. It's like there's so many other companies across the globe that are working towards developing products, sending rockets to space. I think it's really cool that we're no longer constraining ourselves, but actually expanding the industry, providing more jobs, which also same thing applies for internships. You don't have to just be at NASA. There's so many other companies that do similar missions, if not very similar, that, would provide you that same hands-on experience. So that's really great advice. I didn't think of that earlier.
The other advice that I have, if you are a young person who is interested in research and wants to understand what do we really do, I would really suggest to attending some of the NASA conferences. Some of these conferences are free to attend. You don't have to pay anything to attend, like Human Research Program, Integration Workshop, Investigation Workshop, not Integration, Investigation Workshop, right? That is free to attend. NIAC is a NASA Innovative Advanced Concept. It's also free to attend. ISS R&D, you have to pay for that one, research and development in ISS, but you can still go and talk and interact with people and ask questions. I have seen a 12-year-old, 13-year-old show up on those conferences. It's a little bit harder when you're younger, because the topics might be very more towards the experts and more of the technical language to it. But I've seen a lot of folks come and ask questions. We are happy to answer. We are open to answer questions, and we're looking for ideas. And when you're younger, you have much more hands-on activities and know more of the technologies that are out there, and we will want to capture that. So I highly recommend that. The second thing that I wanted to say also is that don't give up. I applied for pathway program 4 times, and I would interview very well, but there wasn't no job to give me. So there are not many bioengineers at NASA. So I kept applying and kept applying and kept applying and kept applying. And that was the best advice anyone gave me. I have that photo behind me. I don't know if you've seen it or not. It's a frog actually in the mouth of a um, bird from sea that's trying to eat it, and says never ever give up. That was advice that my mentor in university gave me. It was a picture that he gave me. It was a printout, and I carried that with me for past 10 years. So never ever give up. And if you get really tired of it, you just keep looking at that frog and say, okay. And the frog is choking the bird, by the way. If you haven't seen it, it is one of the best advice that I got. A perseverance, having the curiosity, and working hard. That's what get you anywhere you want to go, no matter who you are.
That is amazing advice, not only just applying to internships, but also just in life in general, whether it be like middle school, high school, college, grad school, PhD, beyond. There's always different challenges for every grade level or age, and being able to have that concept of never giving up and just chasing your dreams, having that innate curiosity is so important. Not forgetting why you love what you do is also very important. So I think also that's, great advice that all of us should try taking the hand. I know sometimes it's really difficult for us to just hear to never give up, but seeing examples of people who have applied again and again, or people who have actually stuck with it and have seen results is always so, like, it gives us a sense of like, oh, okay, we can also be like them, because we don't, they went through it, they didn't give up, and they succeeded. So that's exactly what, amazing advice that actually worked. So that's like awesome. And, kind of transitioning a little bit from the research aspect, a little bit of that, I kind of want to know, could you share your story of how you got into the space industry? Like, what made you curious about space? Did you have some twists and turns in your journey? Like, could you share with us, like, maybe a short synopsis of what got you into space?
Oh boy. So that's a very long story. I didn't know about the space application the way that you guys talk about. I knew a little bit about astronomy when I was in middle school and high school. I was born and raised in Iran, in Tehran, and I did a math Olympiad and physics Olympiad. Based on the Olympiads, the problem solving was based on the Russian space program. So I was familiar with satellite flights and how the satellites works, but not much about what else is going in the space applications. And undergraduates, I got to learn about aerospace medicine a little bit, and the Mayo Clinic in Scottsdale specifically, and what they did. And I came to learn about some of the adaptations of human space, and it was very intriguing, but I didn't know what to do with it. So for my master's, I had a professor who was Dr. Vincent Pizziconi, who was very open to complex adaptive systems idea, and how the complex adaptive systems happens and what is the adaptations in the spaces. So I did my master's looking at designing a system to understand bone loss of crew members, and I came to understand and appreciate the complexity of the flight and the human adaptations in the flight, and more understand that there is this dynamic resilience of human that is beyond what we understand today. Along with this understanding, I was working and developing medical hardware. The center that I was working with, they were releasing 35 to 50 medical hardware every year. So some for the companies like Medtronics, like Mayo Clinic, some like African countries, Chinese countries, and the low-income countries. So I got a very different, diverse background, and I really wanted to study medical hardware design in space applications, but I couldn't find it. I didn't know what is it called. So I went to Boston, working for Boston Scientific, and I came across this program in MIT that at the time I did not know. They were the pioneer of bioastronautics. I met Larry Young. Professor Young was very kind, and he allowed me to become affiliated with his lab and taught me about hypergravity and effective hypergravity and centrifuge and all medical and related adaptations of humans' respect to gravity. And while I was working in there, and we talked about the field of bioastronautics, and that was my introduction to aerospace and interest of becoming in aerospace. I never thought that NASA would look at my application because I was Iranian American. It was just something you were told that never gonna happen. I was a US citizen, but still everyone told me that since I was born in Iran, it's just not gonna happen. Um, I was a little bit more perseverant than most people. I didn't take no as an answer. So I kept applying and going around. I went to my master's in University of Colorado Boulder and working on linear sled and looking at the linear transitions of the gravitational impact and keep trying to come up with the biomedical equipments. And everyone told me that theirs doesn't exist. No one does that. It just happens that people have equipment in the station, and that answer did not go well with me. I kept asking, going to conferences and asking and asking and asking till a friend of mine said, you know what, I work in this lab in NASA, you might want to go and talk to them. So I went down to Houston for a conference and talked to those guys, and I realized, no, they do exist. There's an actual laboratory that does this. There's actual facility
Wow.
in USC. And the internship got opened up. I applied, and it was exactly as what I expected. I was fortunate enough that by that time I had went through understanding of what is the biomedical design processes is for Earth, and be able to watch and understand what are the differences between the biomedical design on Earth versus biomedical design in the space, whereas the FDA laws actually comes into the place. How does FDA applies for our astronauts as they are in the station? Station considered a national laboratory, so it is should be part of FDA, and how does those things plays the roles, and also watch some of the companies developing their systems. So when the opportunity rose to work for NASA and become a pathway, I did. And then they asked me, why do you want to work for NASA? I realized I never really wanted to say NASA rather than the space exploration that impact of the humanity that it has. I am very lucky to be a civil servant and serve the civilians and be able to apply the knowledge that I'm learning, not just based on what I've learned before, but what I'm learning for the future and being able to bring it back to the earth. So my goal was to talk to more people, learn all that knowledge, and be able to translate that design processes and apply it back into designing a medical hardware on Earth. And I went all around in NASA and I kept asking questions. And I got to meet a lot of wonderful people that they're willing to answer my questions. I haven't yet got there yet, but I'm hoping in next 10 years of my career, I'll be able to share more of that information and bring it back. I started small. I have shared some of these information in aerospace medicine conferences, and I had a discussion with FDA last year. But it is very important to remember that going and exploring allows us to come up with a new way of thinking.
Yeah.
And that new way of thinking will help entire humanity. I understand it's very expensive. I know a lot of people asking, so why should we pay this
Like
much of
billions
money
of dollars.
for a space?
Yeah.
The answer is the needs and the requirement allows you to innovate. And that innovation, it doesn't happen just for space. What we see is extraordinary. What our astronauts experience is extraordinary. Some of them sounds very scary. The chances that someone goes blind is scary. But the fact is, we understand what is going on and we learn from that and we can help the people on Earth. And that is wonderful and extraordinary. And that's why people like me are sitting here and wanting to be in the space applications. With all of the naysayers that are out there and that told me don't even think about applying. For a first week of working at NASA, every day I was worried that somebody gonna pull me over. I said, "This is a joke. You're not working here." Uh, I lost my PhD at University of Colorado Boulder. I had to start a PhD again because I wanted to understand the science. So I never gave up. I had many folks telling me that you should not be in this field. But bottom line is, if that's what you want to do, no one can tell you what you can do and where you can take it. Just remember what is important. Is it the exploration? Is it impact on people on Earth? What is it that you want to solve? That's the most important thing that you have to figure out. Sorry, I went on many tangents.
No, that was
That was
very
not the
beautifully
small answer.
answered. That was beautifully said. And there were some very important points you mentioned. I mean, first, understanding that space innovation also applies to humans on Earth and it's not unapplicable. I feel like a lot of people are like, why are we spending so much money? I mean, which is not actually a lot of money if you look at the big budget the government actually has. It's not that much, but if you still think it's a lot, it actually helps a lot of innovation here on Earth, medically, technologically wise, human comfort, just a human, like the way we're living now, the technology we have, the fact that we're able to, even in a pandemic, connect with other individuals is because of technology that have been fostered through space innovation. And I think that being able to wrap your heads around that really complex topic can allow everyone to understand the beauty of space innovation and the industry itself. And secondly, you do mention never give up. I think that's like a constant theme throughout our interview that you really mentioned those three words. And I think it's so imperative to all of us to always keep that in mind. I mean, you were saying how you had to restart your PhD, and no one's path is ever easy. Everybody has their own set of obstacles. But knowing that if you like never give up and you always just keep working towards that one curiosity you have or that one goal, whether it be helping humanity or exploring more, like you were mentioning, I think that's a really important thing that you mentioned that we all need to keep in the back of our heads. Sometimes people can feel demotivated because of a certain failure, a certain test score, but knowing keeping like your head around the broader perspective is so important. And I think that's beautifully said.
I have failed TOEFL exam more than 6 times. TOEFL is the English exam you take for getting into English universities when you come from another country.
Mm-hmm.
Fail. Don't let your failure define you.
Mm-hmm.
Pass on those. So as you said, the obstacles are not one or two, but the reality is, if you really want what you want, you will keep going at it. And I haven't found it yet. I'm still going. I have a lot to go. I mean,
Yes.
I'm just starting, and this is just an exciting time to be part of a space exploration. We have commercial crews. We have, NASA going to the moon and hopefully going to the Mars. And I'm stoked. I'm looking forward to watch the first woman walk on the moon and
Yes,
see
me
what
too. Very
happens.
excited. Yeah, I know. I'm very excited. And I think what you said was really important about failure doesn't really define you. My parents always told me ever since I was a little kid, of course, when you're little, you think the biggest problem is, the one little thing that happened. And so ever since I was little, my parents would always tell me saying, a failure is not something that you should take as like, okay, I'm done. Like I failed this one thing, so I'm done. I'm just gonna switch and go somewhere else and not address this failure. It's something that, it should help you like learn and grow as a person, and every failure is actually, you should take it as a positive thing because you're learning something out of it. Whether you learned you did something wrong in the past and you learn from that failure, or whether it be like it teaches you the importance of, like family or, connections and everything. Like everything is like a learning lesson. So if you take it as like someone is teaching you something, it's so much better than thinking of it as like, oh, I'm done, like I failed. So it's just like, don't think of a failure as a failure, and definitely don't let it define you, like you were saying. So I want to thank you so much for taking some time to conduct this wonderful interview and for sharing your advice as well as your story. I'm so excited to see the amazing things that you do accomplish as your journey does continue. And thank you so much for your time.
I really appreciate your time actually. When you reached out and I realized how young you are, I was super stoked. What you are doing is very important. Keep doing it. Keep
Thank you.
reminding people. And we love to see young people get more ignited. We love to talk to young people. We love to have them around. And if the opportunity arose, we love to share our knowledge with them and show them the ropes to get to the field and do whatever their dreams is. So don't be afraid to reach out. Don't be afraid of asking questions. We are here to answer your questions. It is our job to share our knowledge. It is our passion to share our knowledge more than anything else. So thank you so much for reaching out. I really appreciate that.
Thank you for your kind words. I truly appreciate it.